Now, you might think to yourself, radiology or emergency medicine, how is someone confused between these two things? And on a surface level, I understand that. One is very patient forward, and one might be thought as not very patient centric, not interacting with the patients themselves. But there's a part of these that are very similar, and it's that you're constantly searching for a diagnosis or a problem. The thing that I would urge you to find in each of these fields is what part about caring for the patient do you get the most out of? Because in both of these, you're looking for the diagnosis. For emergency medicine, where I am, a lot of the time we don't get the actual diagnosis, but we get the direction in which the patient should be heading towards. I don't know why exactly your heart is failing, but it is, and you're in CHF from something. So I'll treat you supportively, I'll get cardiology on board, I'll do an echo, I'll get the ball rolling, and then send them on their way. Oftentimes, the way I find out the final diagnosis of a patient is by chart reviewing them several days into the future when they're under a different service. But I get a lot of gratification on getting the ball rolling in the correct direction. I don't need to be the final person to figure it out. Diagnostic radiology, on the other hand, you are also getting a lot of diagnostic value. But you don't get to be that person, oftentimes, I'm assuming, who says, you have X problem, this is why you're feeling this. You might find the meningioma that's been causing these headaches that are worse when they lay down, but in most scenarios, you're not the one delivering that information. For me, that would be very hard. I like to be with the patient physically in those moments. But for you, you might get a lot of fulfillment just by the diagnostic value itself. So for me, I feel like those are the things that I would consider. In addition to, one of the other common things is, what's the more mundane things? Do you get a lot of satisfaction out of that? For emergency medicine, ACS, belly pain, headache, shortness of breath, asthma, CHF. Do you like the bread and butter things? For diagnostic radiology, would you not mind looking at a bunch of chest x-rays that are normal? Or CT heads that may or may not actually have a hemorrhage involved? I don't really know what the bread and butter of diagnostic radiology is, but that's what I would imagine it to be. I would consider those two make things first before you get into finances or job outlook, knowing that both of them are important and both of these fields are going to be around for a very long time. Best of luck figuring it out.